Mortal Van der Waals syndrome. Fun fact, did you know that almost all children with ADNP syndrome have a speech delay? The average age for first words has been observed to be 30 months, with a range of 7 to 72 months. Some individual studies did not develop any language skills. Everybody, my name is Dr. Andrea V. Rojas, and today I'm excited to talk to you about a rare genetic disorder known as Van der Waals syndrome. This syndrome deserves our attention, since it is yet a syndrome that is common but is mostly rare. But it should be talked about since this syndrome faces fewer than 50,000 people in the US. This syndrome presents unique challenges, especially considering that it is associated with delayed development and disabilities. Let's take a deep dive into the effects, challenges, and science all behind Mortal Van der Waals syndrome. Information upon this syndrome. Mortal Van der Waals syndrome is a rare genetic disorder characterized by intellectual disability, development delay, speech and language difficulties, and behavioral issues. Other symptoms may include autism spectrum disorder, seizures, and physical abnormalities. Treatment for Mortal Van disorder syndrome typically involves a multidisciplinary approach that may include speech therapy, occupational therapy, behavioral therapy, and educational support. I was doing my research. I saw that there are no specific experimental treatments for this syndrome, and it is rare and it is newly identified. So as I looked into it, the potential therapies and the potential interventions, and I noticed that the specific syndrome is ongoing, and the clinic trials and experimental treatments may be limited at this time. How was this syndrome created? This inherited disorder is a suspected sign of autism, and it was made through genetic changes and mutations in the Adnp gene. The protein produced from this gene helps control the activity of other genes through a process of chromatid remodeling, a network of DNA that is packaged in chromosomes. On a side note, it is important to consult with a healthcare professional or genetic counselor for accurate and up-to-date information on this specific disorder. Van der Waals syndrome, including symptoms, treatments, and inherent patterns. Mortal Van der Waals syndrome is caused by the mutations in the ADNP gene and is inherited in the autosomal dominant matter. This photo demonstrates that the mutation is only one copy of the gene and is sufficient to cause this disorder. This is why the circle in this specific photo is red compared to all the other colors. As we explore the various signs of ADNP syndrome, this syndrome is mainly seen as a condition that causes a wide variety of signs and symptoms, mainly including autism, which is seen as a spectrum disorder and characterized by impaired communication and social interactions. Other than autism, ADNP syndrome faces other factors, which include distinctive facial features, which mostly common include a permanent forehead, a high hairline, outside corners of the eyes that point upward or downward, upslanting or downslanting, droopy eyelids, a broad nasal bridge, and a thin upper lip. These individuals may also have unusual shaped ears or hand or finger abnormalities. Eye and vision abnormalities such as eyes that do not point in the same direction also occur in ADNP syndrome. Some people with this condition have early appearance as well, such as little baby teeth, and some people may have weak muscle tone. Although this disorder is mainly an autism spectrum disorder, all these factors include the most common genetic causes of this condition. Now, when we talked about symptoms, we are now looking at the range of development challenges. Things like intellectual disabilities, delays in speech and language skills, and sometimes individuals might have certain facial features that can tip us off the syndrome. Now, before I keep on going with this project, I wanted to add a specific part in the research that I did. As I was researching upon this syndrome, I found a specific article regarding a child with ADNP syndrome. This syndrome, again, is borderline autism, and I got to experience and I got to read into the paragraph explaining how this child has gone through it, the features the child has, the stages, and all. So in the next part, I will be explaining that. As for background on Adnp syndrome, also known as Hell's-Motel-Van der Waals syndrome, is a condition caused by development delay, language impairment, autism spectrum, and variable intellectual features. In this study, a 4-year-old female Chinese patient was reported with delayed physiomodal development, language impairment, anxiety, aggressive behavior, and congenital heart defect. This sequencing, a copy number variation, was performed. In this specific research, Adnp protein plays a crucial role in the brain formation by regulating the expression of many other genes. This functional investigation of mice indicates that the Adnp gene results in cognitive and social deficiencies. In this study, we described a female pediatric patient with mild congestive impairment, language development delays, abnormal gait, behavioral abnormalities, and congenital heart defect. Genomic DNA samples were extracted from the whole blood using relaxed gen blood DNA system. With this system used, the target genomic regions were captured by hybridizing the genomic DNA sample library. By doing this, the sequence was performed, in which reformed 24 chromosomes. This was counted in each bin and was compared between all the test samples that were shown by the DNA and run in the same flow cell that evaluated the copy number, which changes. As the facts were given by the parent of this 4-year-old female child, the third pregnancy of this mother went well, and the tests were normal, but the child was born at a full term by a C-section section, with a birth weight of 3,900 grams. As this was shown, this defect carried out when she was 3 years old. After the operation, the patient's heart was in good condition and had no regional shunting, and was shown by this doctor. She then started walking without support at 18 months. The patient had a normal range of motion, but she had poor control of her limbs and abnormal weight, which these specifically was one of the symptoms that I talked about. She then had a broad nostril bridge, short and thick neck, and short upper limbs and fingers. She also showed deformation of fingers, likely due to her actions of frequently biting and chewing on her fingers. She then started premature teething, which happened at 3 months old, and almost fully by 1 year of age. Then, towards the end, when her parents and caretakers started to feel as this child was socially inferior to the peers and lack of self-care ability, she began to have behavioral issues. She then started to improve her language skills and gotten better during time. This number copy variation, which was carried out in the DNA sequence, was performed on blood samples and showed that she had potential genetic abnormality. These photos that I showed show the examples of the sequences found throughout the figures of the mother, father, and the child, as well as the photos of the symptoms that this child then has. Now we'll be playing a YouTube video describing Genie and his Adnp syndrome and how he takes upon it in his family.
The best advice that I could give anybody when they get a diagnosis is that it will get better. I look at his syndrome as we're living in the here and the now, and I'm never going to give up hope. Although he's nonverbal, I know in my heart that he will speak. Live in the moment, have belief, and advocate for your child. You are the only person that can advocate for your child, so that is part of our mission, is to not give up hope.
As watching this video, it is important to understand how Adnp syndrome affects the patient mentally and physically. This video gives a clear vision on how the child is unverbal, but treatments and care still give hope. In the next slide, I will be showing my works cited log, and I want to thank all of you for listening and participating in my research experience upon Hell's-Motel-Van der Waals syndrome. If you have any questions, feel free to let me know, and remember to stay intrigued.